Now I'm also recording and editing some videos. So like, it's not great content. That's okay. I'm going to shut up. Welcome to the Medicare Cafe. As always, I am Olivia.
Mike, and today we're talking about the survey that we put out every year, the pre-AEP survey, and really the focus being retention this year with the results of the survey. So let's jump into it and not waste any more time. Every year we ask for the past at least 4 years, as you can see, we've asked how many clients do you have in your book of business, and we've seen a steady growth of agents that have big books of business. So half the agents that we surveyed out there had 200 plus clients, which means that they are really focused on their book of business in AEP rather than client acquisition, as opposed to the agents that have 50 to 75 clients, where they're really focused on building those numbers in their CRM. These agents already have it. And as you can see, 0 to 50 has declined each and every year because agents are getting more experience, which gives them more clients. Continues to go on how many MA plans you plan to sell as AEP. And this is new MA plans, not rollover. So as we talked about in past Medicare cafes, if you have 100 clients and you have 50 changes, you still have 100 clients. These are, I'm going to add new clients to my book of business during AEP. As you can see, roughly 50% said almost none, under 15 apps. And then the rest of the market's kind of all over the place, with more than 75 only being 6%. In fact, 50 plus apps has only been about average 6% of agents. So last year, as you can see, there were obviously some markets with some fluctuations. This year, we're seeing much more steady business, which means it is retention, retention, retention. Last but not least, one of the other questions we asked to reiterate some of the information we talked about is how many clients do you think will change plans? And over 80% have less than 30% of their book changing. So again, every question we asked in pre-AEP survey, it's a hard one to say, is saying, look, I'm just looking at my book of business and going, how am I going to keep my clients with me and not calling the 800 number they saw 5,000 times between TV commercials and radio ads and mailers and social media ads, etc. I want to make sure my clients aren't calling those numbers. So we're at stable markets, which means focus on retention.
Now, one thing I think that could absolutely help out with a lot of this is what you're doing between October 1st through October 14th. Because if those clients aren't going to be moving, you're not seeing a ton of movement this year, and you're just working. It seems to me the numbers don't add up. Because if you're not really expecting on your clients to be moving very much this year and not expecting to have to do a lot of that, but you're also not expecting to get a bunch of new clients, what are you doing? So again, making sure that you can handle a lot of your current clients and work on that retention October 1st through October 14th. They need to hear from you. They need to know that they're on the right plan. They need to know that they don't have to make any changes or don't have to do anything to change plans. And then that way, October 15th and beyond, that's going to be whenever you're getting new prospects. What I'm afraid what these results are telling me, and what I'm really worried about, is I think we're going to see a ton of agents this year hit that November lull. They're going to do all the retention work and really have a really strong first couple of weeks of AEP, and then come November 1st, they've seen all their current clients, but they don't have any prospects. So I just want to make sure we're all really working hard to avoid that November lull.
Oh, that's a great observation. Yeah, and that's a great point, because if you don't want anyone to move, it's, hey, stay put, ignore all the ads, you're good to go, and then you're done. And then you could rip through a bunch of people quickly between the 1st and the 14th, like Olivia was saying, and now you're just sitting there going, now what? Oh, crap, I ran out of stuff to do. So hopefully you have all your letters stacked up, ready to go and mail out Wednesday night. So tomorrow night, so they hit the mail October 1st or postmarked October 1st. Next, have that call list ready, have your email blast ready, have your social media lined up. You can schedule your posts for the next handful of days or weeks, so you don't have to worry about it. You can sit down tonight and go, okay, I'm going to make 5 posts for next week because it's AEP, and I'm going to have 4 things post, and then you can wipe your hands and forget about it. So the more you do now, the easier your AEP will be. But again, if your clients don't hear from you, you're basically saying go do what you want. They're obviously going to be solicited to do hard this year because as carriers see stable markets, a lot of them are doing land grabs where, hey, look at our dental, look at our ancillary benefits over here, look at the gym membership we offer. It's less, excuse me, it's less about the policy itself, and it's more about the perks and the bells and whistles. And all it takes is one person to say, well, I capped out my dental this year, so their dental looks a little better, I'm going to change plans. And if you don't want your clients to do that, they need to hear it from you, not from TV commercials.
I also think, again, in addition to doing your retention and getting those referrals, I do think everybody needs to maintain their marketing plans. People are still turning 65 the last quarter of the year. People are, especially now, who are retiring. So AEP doesn't mean the rest of the world stops living. The only way that for you to make sure your thumbs aren't twiddling on November 1st is to start that marketing campaign in October. Remember, it takes about a 3-week turnaround period for any lead drop, any marketing activity. It takes about 3 weeks for you to really see any benefits from that marketing activity. So if you start something in the beginning of November, then it's going to be December before you really start seeing any results from that. So you have to make sure you continue your marketing efforts all through AEP.
100%. And if they don't remember you, they don't refer you. And if they leave you, they're definitely not going to refer you. So you've got, again, retention, 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 and that, of course, leads to referrals. The number one marketing strategy that agents are using this AEP and every AEP in the past has been referrals. Go to your book of business, go to people that trust you and say, hey, let me talk to your friends and family. My allergies are starting to kick in myself. And say, hey, I helped you, let me help others, and you have the same level of service. So if you want that referral stream to be coming in, you have to have the retention plan in place to support it. They go hand in hand. You can't have one without the other. It's hard to get great referrals if you have no retention, and if you have no retention, now you can get referrals. So if you think, oh, retention sounds like a pain, well, that's how agents are getting referrals. So make sure you're doing that. If you want to see the results in full, including what agent comments had and such, you can download the guide. We sent it out in the newsletter Monday, the Senior Marketing Specialist newsletter. If you didn't get it, let us know. We'll repost it on the Facebook page for Medicare Cafe, but you always call and we'll send you a copy of it so you can see what agents are saying, what their strategies are, if they're using e-apps, any additional comments, what they're doing differently for COVID. All those questions were asked in this pre-AEP survey. And if you're thinking, how do I retain my clients? We put together a guide for you. So, and it's a post email going out more than likely tomorrow morning. You're going to get a client retention guide that covers some kind of more popular retention methods. Of course, there are many that we didn't list because we didn't want to have it to be 500 pages long, but we took the most common ones we see among Medicare Cafe agents and put them in a guide. So make sure you take a look at that and start implementing your retention at the initial appointment or at your next appointment. There should never be a mystery why you're calling your clients, because if there is, they're, like Olivia tells us a story about a financial planner, their defense wall is going to go up and be like, why are you calling me? We talked 3 months ago, now you're calling me again, what are you trying to sell me? And that's going to look bad for your clients and can leave a very bad taste in their mouth.
Exactly. I have nothing to add. You nailed it.
Oh, thanks. So watch for that. I will say our MA, PDP, AEP acronym toolkit is still live, of course. Make sure you visit that for carrier resources, for marketing materials, enrollment tools, scope of appointments. This year, of course, is going to be different with COVID, but I'm seeing a lot more agents saying, hey, I'm still going to see my clients face to face. COVID's been around. It's starting to lift off. I saw a friend of mine post that, he wanted to go to concerts, and they're starting to see some states really loosen the reins on restrictions. So it's perfect timing for AEP. Maybe you can start to see your clients or have a couple in the same room as long as you're socially distanced. So maybe what you used to do may come back. But again, we're on the tip of AEP, so it might be too late to start scheduling those things. But don't be afraid to offer, hey, let's meet together in the same room. We'll just sit at different ends of the table, and I'll just, throw paperwork at you while we're talking about it.
Again, I think the important thing is to have multiple avenues to meet with people. We've seen how this COVID-19 is so politically charged. Some people are very intense. You should be wearing a mask. You should be socially distancing. You should be staying at home. Other people are the exact opposite, saying that the whole thing is just poppycock. So it is because there is no middle ground really. What we're seeing right now, there is no middle ground. So offering multiple ways to be able to meet with your clients, it's not how you want to sell,
Oh,
it's how they
froze.
want to buy. So you have to make sure you're able to offer their solutions. I can't
Did
hear
you
you.
say it's poppycock?
Poppycock, yeah.
Did you say it's poppycock?
Hmm.
Good word.
Poppycock?
Oh,
I
that's
don't know what
fun.
that
I
is.
like that.
Is that an offensive word? I don't know. That's poppycock.
No, you know what? I think we should bring back all those fun old-timey words. Like
Oh,
hogwash. That's right, Brian. Hogwash. That's a great one. Especially
yeah.
when you're a city boy and you have no idea what that means. I'm assuming it means washing a pig, but whatever.
I'm
Either
gonna
way,
say she's more nervous than a cat on a hot tin roof on a summer day. I'll go.
Tara Richardson. All right. So, but yeah, anything we do to help you, we do have we do have and I didn't make a slide for this, so I apologize. But if you go to Medicare Cafe Agent Group, which I finally got back in this morning, we do have that MA only veteran centric. It's a long description campaign. So make sure you download that. And if you're looking for social media content, there are 10 photos and 2 short video, like little advertising videos in there that you could use with some post ideas. So we don't have any veteran flyers yet, because again, making flyers for MA plans requires CMS approval in most cases. However, check the carrier toolboxes, because a lot of times they'll have, agent approved pieces that you can customize, download, and print yourself. But we
Mhm.
do have the campaign ones that are very generic in nature. So they're just saying, hey, if you're a veteran, you may have some options, blah, 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 blah. So that is free in the Medicare Cafe Agent Group in the file section. Just go in there, download it, and use it if you want. Don't use it, whatever. But you can make your own posts. You can use your photos however you want. They're not CMS approved, but they're generic, so they don't have to be.
Again,
I
remember,
would
if
say,
you have a contract with senior marketing specialist, you do have access to the seminars in a box. And there
mhm.
is a veterans-based seminar on there, which is great content for a Facebook Live or a virtual seminar as well. So if you're interested in getting after and looking at the veterans market, make sure you utilize that portion of senior marketing specialist.
Yeah, and I will stress that if you have an MA only plan coming to your market, that's where you need to focus, because if a carrier makes a new plan, they obviously want to get enrollment into it to make it profitable. So that's where a lot of their marketing efforts will go. I guarantee you will see more American flags and eagles and veterans on TV screens and ads than we have in years past. So make sure your clients aren't going, oh, to get that veteran plan, I must have to call the 800 number. Make sure they know they can call you. So Jim, great question on the flyer thing. Again, we don't have flyers, but we have social media posts, and I would say just hammer away. Maybe I saw one agent or talking to, and they said what they're doing is basically they're sending out an email, a bulk email to all their clients every Friday in the AEP. They're going to send out a newsletter saying, hey, with tips and tricks and anything else. So don't be afraid to over communicate this AEP, because they're getting it from every angle. I guarantee if no one's gonna say, well, they've emailed me every week, it's over the top. Everything's over the top right now. So you'll just blend in the mix. So I think that's a great idea. I forgot who is doing it, so I apologize. I'd love to give you credit. But they said, yeah, we're making calls, but every Friday we're sending out a newsletter to our entire book of business, whether they want it or, well, they've subscribed, but they're getting it.
Rose asked a great question. She says, on your business card, can you write that you help with final expense, Medicare Advantage, Medicare supplements, and annuities? If you don't mention any carrier specific name and you write Medicare Advantage insurance, Medicare supplements insurance, then that shouldn't be an issue.
Yeah, being the true nerd I am, I have I'm looking at my screen here. I have the actual verbiage from Social Security talking about use of the Medicare name, but of course I can't find it. Let me look real quick. Dun, dun, dun,
You
dun, dun,
might
dun,
also
dun.
on your business card, you also have to put on your title. So licensed
Yes.
insurance agent, licensed sales representative, something like that. So as long as you have your title on there, it shouldn't be an issue. Reason for that is because you just need to make sure that somebody can't be confuse you with the entity of Medicare.
Yeah, so basically in the highlighted section here, it says you can't use it in such a manner which a person knows or would know in a convenient manner, blah, blah, blah. Basically give false impression that you work for them. So as long as you're saying, hey, I sell Medicare supplements, great. I sell Medicare Advantage, perfect. And like Olivia said, you have to have a title like insurance agents, but your slogan can't be Medicare. So it could be like Rose, your last name, licensed insurance agent specializing in Medicare products. Because that says I'm an insurance agent, and then your tagline can be whatever you want. That's where you really hammer the Medicare specialist in there.
So the title field underwriter has been looked at. You got to be a little careful. I think field underwriters, I don't think there's a compliance issue with that. I do know that, again, it's carrier by carrier. United Healthcare, who is basically the most strict, has come out with pre-approved titles of what they will allow. And field underwriter is not a pre-approved title. Not saying it's not compliant, but it wasn't listed as a CMS approved title via United Healthcare.
Yeah, field underwriter just, I mean, basically you're trying to tell the world that I do underwriting in the field, but underwriters are traditionally not paid commissions. So if you're an insurance agent and you hold an insurance license, guess what? You're an insurance agent. Just tell people. There's nothing wrong with it. It's all on how you carry yourself, in my opinion. So I've never used the term field underwriter. I know agents who have. It's kind of like when people say they're automobile consultants. You sell cars. Just don't try and doll it up. It's just tell me what you do for a living. And if you're embarrassed to say you're an insurance agent, why would I have confidence to have you be my insurance agent? So just keep in mind that people can interpret that in a very negative way. I hate to say it happened to anyone down the cafe. So make sure again you're using the approved titles.
Mm-hmm.
And Tom said, in addition to using the United States Postal Service to mail the AMP 2021 AEP newsletter, what other ways can you use it? Great question. Is it okay to email to non-clients? Can you use it on bulletin boards, reception desks, senior communities? Yeah, do an airdrop, whatever. Just fly a helicopter and throw them out the window. Of course, there's littering involved, but yeah, you can use it however you see fit because it's generic. So I would say when mailing non-clients, you can email non-clients. The only thing I caution on email is sometimes attachments can come up as very sketchy. So if there's a way to embed it, great. But if not, getting it like that is better than nothing.
Mm-hmm. I agree. And again, I like the idea of leaving them at senior centers, leaving them at putting on bulletin posts. You're exactly right. Put them everywhere, being that source of information. Absolutely.
Yeah, yeah, it's definitely not horse pucky as Brian has stated.
Horse
Uh,
puppy? I've never heard that before.
I have not either, but that's a fun one as well. So yeah,
Horse,
Tom, I
that's
love Olivia's idea of leaving them at senior centers. Right now, the senior centers in Columbia are closed in our town, but I know senior centers in other areas are open, or grocery stores or anywhere else. Don't be afraid to leave it because worst thing's going to happen, someone's going to throw it out. Best case scenario, someone's going to pick up and go, oh, I should call Tom. He's obviously got his 2 cents about him, and I have questions about cinnamon rolls. So I always looked at it, as long as someone called me, I was happy.
mm-hmm.
And again, the AEP marketing should be wrapping up right now. So basically, all these letters that we provided in our AEP toolkit, you should have personalized, printed, and already stuffed in envelopes. If not, know what your job tonight is? That right there.
And Judy, yes, those newsletters can be left at pharmacies as well. If you have a relationship with the pharmacy, absolutely. There are other marketing materials found on AMP that is actually better suited for pharmacies. One of them includes the medication tracker. It's a little thing that can be folded up and it puts on what medications that individuals taking, the immunizations that they've had, and that way they keep it in their wallet. So pharmacies love to give those out to help individuals, remind them what medications they're on, and help them track them and keep them straight. Those are found on AMP.
Yeah, and I would say if you know of a maybe a senior center or something else that has a newsletter already, ask if you could give some information to them. You know, maybe write a short blog post. It doesn't have to be super long, talking about AEP. So offer content rather than just solicitation pieces. I had a friend of mine in Kansas City used to do that. There was a senior publication that was like 50 plus magazine or something like that. It was a little local publication and all the senior centers, and he had a blog post in there, or basically a blog post, but an article he published randomly throughout the year. That's a great way because it gives them additional content to give their magazine more value, and it gives you the light of an expert because you're writing in there as a professional. So don't be afraid to reach out and say, hey, I'd love to, give you a quick piece about, what annual enrollment is and what's happening in our local market and things to consider. And if you need help with that, call us. I'd say write it out, send it in. We have some great editors on staff for people that can eyeball it for compliance and for coherency, and then send back to you. And then you can send it to them and say, hey, please feel free to use this.
Well, on the AEP toolkit, we also do have a letter and marketing pieces to help you network with pharmacists. So that is something that's on the AEP toolkit. And then that medication tracker that I was talking about, Deborah, is on the AMP program, Agent Marketing Portfolio. Again, that is something that's only available to agents who have at least one contract with senior marketing specialist. So if you do have a contract with senior marketing specialist, you'll just go to the SMS team website, click on services, and you'll find AMP there. Terry said that he got his 2021 Medicare and You handbook. It's about 3 inches thick. Yep, it's a fat one this year. So just keep that in mind. Remember, we do not have the capability to bulk order those anymore. They have to, and so make sure that you have a PDF downloaded as well.
Yeah, and I would say this. So I see a lot of these, I'm on a lot of these forums as well on Facebook where, agents are collaborating and talking about stuff. Just because you read it online doesn't make it true. Can you leave business cards at pharmacies? If pharmacies will let you, yes. A lot of corporate pharmacies have very strict rules on what you can and can't do. So you can leave business cards at pharmacies if the pharmacy allows it. A lot of them don't. They don't want that there because then their philosophy is if I display your card, I need to display this person's card, and that person's card, and this person's card, and it's just chaos. So if you have a personal relationship with them, great.
Mike's talked about in the past that a lot of pharmacies are very slow to ask agents because agents oftentimes will refer clients to use mail order options, eliminating that pharmacy. So if you do want to network with the pharmacy, what your approach is, hey, I will make sure I put them with the plan that helps your pharmacy out, that gives that uses your pharmacy, and I will show them the benefits of using your pharmacy versus a mail order option. So just when you're working with these organizations, you have to figure out what's in it for them. They're not going to do something just out of the kindness of their heart. It has to have some sort of benefit to them. So finding out things like utilizing them instead of utilizing mail order options is a good reason why a pharmacy would recommend you. So just make sure you're figuring out what exactly you could do to help them.
Exactly. Now, I will say, my wife, who is apparently 67 years old, is still getting pieces in the mail. And this was hey, look from Essence, which is a local MA plan, is already sending her stuff in the mail about 2021 benefits. So the floodgates have already creaked open for some carriers, and it's already starting to do that. She did get a big packet. I don't know where I put it, but from AARP, sent a Medicare supplement packet to her. And I think she threw it out because she gets sick of them. I like to keep them, but she's like, I think she gets mad because they age her, and that's my joke, and they're stealing it from me. So that's rude. But don't think that your clients aren't being bombarded already. And then again, like I said, on Thursday it turns up to 11 for the next 54 days, and then turns back down to about 3. So anything you can do to get out there, definitely. But pharmacies, I will tell you this, I sat in a Walmart with Humana, and they were real big about, hey, corporate has these rules, so we can't do that. So if they're saying no to you, don't take it personally. It may be an order from up above to say we don't have that available, or we can't do that per corporate policy. If you have questions, go to Medicare Cafe Agent Group. It is available. We got some stuff in there, including the veteran-centric campaign. So make sure you download that. Oh, that's the other thing I was going to say. Saw a conversation on one of the Facebook groups about scope of appointments and what you can sell. Always err on the side of caution, because one of the questions was, can I sell a long-term care plan at a Medicare Advantage appointment, because it says health options or health plans on the scope. And while one carrier may be more lenient, if you go in there and they change gears and go United Healthcare, United Healthcare has said no. So now you're in violation with United Healthcare. Maybe not CMS, but you are in violation with United Healthcare. So just be smart about it. There's nothing wrong with seeing your client a second time. It helps build that rapport. It helps build that retention. It helps open the door for referrals. Now you might have to go back in a couple weeks or maybe a couple months, and that's okay. You keep that communication going, and the more they like you and see you, the more they're going to trust you, and the more they're going to talk about you. So I love these agents. Like, I just want to be one and done. Well, that's not great customer service for a lot of people. That's all I got.
Awesome, guys. Make sure you like us on Facebook just to keep track of what we're doing. Mike and I are going to be, and as well as Sadie, are doing a lot of really cool things the fourth quarter to help promote and pump up Medicare Cafe. We will continue Medicare Cafe all through AEP. They're just going to be shorter ones, more so just check-ins and what we're seeing. So make sure you join us, take a little break during your AEP. We're also got some cool content coming up starting in the fourth quarter. Can't share too much information right now. I want to leave a little bit of mystery and a little bit of surprise, but stay tuned. We got a lot of really cool things coming up.
Absolutely.